that's me as well.
And Adrian, if you want to mute your mic for the time being, I think we'll be okay. All right, we should be going live here in a minute, guys. Good evening, everyone, and welcome to the Sedgwick County COVID-19 Vaccination Question and Answering Town Hall. We want to thank our physicians for being here with us this evening and spending your time to help educate us a little bit more about the COVID-19 vaccine. I am Akeem Ashford, the Communications Director here at Sedgwick County, and I'm very happy to welcome all of our physicians. We've got Dr. Gerald Menz, Sedgwick County Health Officer and Dean of KU School of Medicine, Wichita. Dr. Maurice Duggins with Ascension Via Christi. Dr. Carolina Pereira, Sedgwick County EMS Deputy Medical Director. Dr. Maggie Hagan, Infectious Disease Medical Director with Ascension Via Christi. Adrian Byrne, she is our Sedgwick County Health Director. And Joan Tammany, Executive Director of ComCare of Sedgwick County. Tonight, we will focus on the Pfizer and Mrna COVID-19 vaccines that have been distributed all across the country. As you know, the Pfizer vaccine is kept in ultra cold storage, and Sedgwick County has received 3 ultra cold storage units here in the last week. Hospitals in the community, including the Ascension Hospital System and Wesley Hospital, both received Pfizer vaccines to use with their staff. The Sedgwick County Health Department and federally qualified health centers in our community received the Mrna vaccine. So far, the health department, following CDC and KDHE guidelines, have vaccinated more than 2,700 frontline healthcare workers in our community. Not vaccinated through our hospital partners have been vaccinated by other partners. Earlier today, the Sedgwick County Health Department introduced a new storyboard featured on our website that provides additional data about the vaccine process. So I want to jump right into this conversation this evening and allow Dr. Menz to lead us off with an introduction and give us a little bit more information that we believe people should know about the COVID-19 vaccine.
Thank you, Mr. Ashford. It's a pleasure to be here tonight. The vaccine that we have available to help us all become immune to this virus has been a revolutionary development. This vaccine, because of the technology advances we've had in the last few years, was able to be developed in a faster schedule than almost any other vaccine in our history. This is due not to the fact that we were just rushing it through, but to the fact that our scientific methods have become so sophisticated they were able to identify the important features of this virus that the body would form defenses against, and we're able to purify it and develop a new technique of developing vaccines, which is just remarkable. So I think we should all be grateful and happy that the research that's been funded over the years and done by our universities and private agencies has allowed us to develop this very effective vaccine in a very quick manner, at least quick in terms of how vaccines have been developed in the past. You know, vaccines have been around for the last 300 years or so to different agents. They are a remarkable development in their own right, just because they have allowed us to eliminate many scourges of infections in the past that have afflicted mankind, including tetanus, polio, smallpox, and many other viruses now that we don't even see the diseases anymore. So they have truly revolutionized medicine in this country. They're one of the wonders of the world, in my opinion. There would be so many additional deaths from these older common infections that we have essentially eradicated to this date. It is our hope that with the vaccine that we have now and other vaccines that will possibly be coming out this year, that we will be able to make COVID-19 to be a disease that our children and grandchildren will not have to worry about in the future, just like we don't have to worry about measles and mumps and polio and smallpox. In that light, I want to encourage everybody that the data is excellent, that these vaccines are safe. It has been tested in people over the age of 16 and 18. The two different vaccines use different cutoffs. and it has been proved safe in ages greater than those ages. And I assume it will be tested later to be shown safe in younger individuals. So I know there are some people out there who've expressed some worry that these vaccines might have been rushed too quickly, but I feel very confident that the FDA and the CDC know that these vaccines are safe and useful for us to hopefully get this virus controlled and eventually possibly, not necessarily, but possibly eradicated someday. We'll see. I think it's important for our community to recognize the need to get vaccinated, not only to prevent excess deaths and the illnesses it's causing, but also this will help get our economy back on its feet. This infection has been so devastating to many aspects of our life, including our economy, as well as our mental states. It's had a major impact upon mental health in this country as well as this community. And I think getting this virus under control will help us get back on our footing and back to resuming a more normal environment. We start worrying about our other problems and not have to worry about this so much, which seems to distract us from all of our other issues that are ongoing. So I just hope everybody feels comfortable with that, and we're happy to discuss that in more detail as the evening goes on.
Thank you, Dr. Mintz. Dr. Duggins?
Hi, I'm Dr. Duggins. I'm with Via Christi, Ascension Via Christi Residency Program, the Family Division or Department. And I'm here just to help support and encourage others to learn about and get the vaccine for COVID-19. I agree it is a very safe vaccine. The data, as Dr. Min says, is very strong. And yes, it has been done at what we call a warp speed. However, it still has the data behind it that supports its efficacy. And we would like to have as many people to take it to reduce the disease burden that the hospitals and our community have suffered from as a result of COVID-19.
Thank you, sir. Dr. Pereira, Dr. P.
So, hi there, y'all. I'm Dr. Carolina Pereira. I am Deputy Medical Director for Sedgwick County EMS, but I'm also a practicing emergency physician. And I would just like to echo the sentiments of my colleagues here. We've seen the ravages of COVID-19 and pretty excited about a path forward. And the vaccine represents that. So I would also like to volunteer that probably amongst this panel, several of us have been not only vaccinated, but are mutation-free. And so just excited to have a way forward through science.
Thank you. Dr. Hagan.
Hi. Thanks again for having me tonight. I'm Dr. Maggie Hagan. I'm an infectious disease specialist. I work primarily at Ascension Via Christi hospitals. And my role in the COVID world is to take care of the sick patients admitted to the hospital. And in that regard, for the last 9 months, my life has been extremely, extremely busy, unfortunately. The patients just keep coming in. We think we have a little lull. We maybe have fewer cases 1 week versus the prior week, and then suddenly we see another surge. So unfortunately, despite everything we've talked about, mask wearing, social distancing, closing businesses, avoiding big gatherings, none of that has really seemed to impact the numbers like we would like to see. So really the only thing I see as the way out of this is the vaccine. And, we've been anxiously awaiting it. We're now 3 weeks and 2 days into our vaccine era here in Sedgwick County. I was fortunate to receive the vaccine on the very first day that morning, and I've had my second dose already. And so from my world, seeing the ravages, as was mentioned, of this disease, I am so hopeful and so thankful, like Dr. Min said, for the science that has gone into the development of this vaccine. Though it has been rapid, I agree that the science and the data and the studies look great. I think we were fortunate to have technology that had been developed that when this virus was identified, they could essentially plug and play, take the genetic material from this virus and plug it into the technology that had been developed, which allowed for the rapid development of this vaccine. And from what I've reviewed on the studies and also our personal experience, I feel it's very safe. And from the studies, it looks very efficacious. So when we look at any vaccine, we look at safety, we look at efficacy, we look at the durability of the prevention that the vaccine affords, and then finally we look at the acceptance in the population. So what I think part of our plan here tonight is to help really encourage the acceptance of this vaccine in our population, because all those things need to come together to make a vaccine successful.
Dr. Hagan, well said. Thank you for that. Out of a full disclosure for transparency, if you all are able to kind of let us know, have you all received the vaccines yourselves?
I have. I've received both the first and second dose. My second dose was this past Monday, 2 days ago, and I am still a human being. Haven't been converted or mutated into any other different forms. And yes, other than the soreness in my arm, I have not experienced any adverse effects from the vaccine.
I have also had both the vaccines. My second dose was yesterday, and I have had similar side effects and just some mild arm soreness. So similar to any other vaccine, really.
I also received the vaccine. I received first dose on the 14th of December, and I received the second dose on the 4th of January. I had essentially no side effects, minimal sore arm. I will tell you that, my experience is the healthcare workers that are receiving the vaccine, because those are the people I deal with in the hospital setting. And first go around, we did have a couple of mild reactions, some a little more than mild. Very few people experienced that. But with the second go around, which started on Monday, I've received quite a few calls and texts of people that, had some fever and chills and achiness and felt kind of bad and maybe didn't feel like coming to work and so forth. All of those seem to be resolving as time goes on. So, and it's somewhat expected that with the second dose, because your immune system is primed after the first dose, you might have a little bit more significant side effect with the second dose. So that's somewhat to be expected.
I too have had the vaccine, but I'm a little slower than everybody else, so I've only had the first dose, and I'm looking forward to the second dose as soon as I can get it. I might just build on what Dr. Hagan just said. Penicillin was a remarkable development in the early 20th century, and it has saved so many lives over the years. Hundreds of thousands of people have been avoided early death because of the use of penicillin, but yet penicillin does cause serious reactions in a rare individual. And we could say that for almost every medication we have, and we can say that for almost every vaccine we have. But most of the time it's very controllable and we can handle it. And so far the reactions we've seen to this virus have been inconvenient, uncomfortable, but haven't been serious. So again, I want to encourage people, they shouldn't fear this vaccine from that point of view, at least based on the people we've already gotten the vaccine.
Wonderful. Thank you all for telling us those stories. Dr. Menz, you play an important part, if not the most important role, in keeping all of Sedgwick County citizens safe and healthy by monitoring the health of our community. In your professional opinion, but more importantly, as a citizen yourself and someone that we now understand received the first vaccine and will receive the second, why is the vaccine important to the health of our community right here in Sedgwick County? And why should people get the vaccine when it's made available to them?
I touched on that a little bit earlier, but this disease has had just a huge impact upon not only our community, but the whole globe. It's affected our mental health. It's obviously led to a lot of premature deaths. Even the people who have survived it have had lingering side effects, whether it's mental fogginess or in some cases cardiac damage. We're still learning about all the long-term effects of this, even from the people who recovered from the initial illness. And it's impacted our economy seriously. Wichita has seen that with the restrictions we've tried to implement to keep the number of cases as low as possible without the vaccine. We've had to impact people's employment, and we've had to impact their ability to run their business as well as they'd usually like to. So it's the only hope we have of getting our economy back on its feet, our society back on its feet in the short term. If we didn't have the vaccine, the only tools we have are the tools we've been using. And as Dr. Hagan's referred to, it certainly isn't killing this virus. It isn't making it going away. It's just holding it at bay. It's just holding the door shut. But it's still affecting us. And if we want to get out of this situation, the vaccine is really the only hope we have right now of getting back to any semblance of normality in our community.
Wonderful. Thank you, Dr. Mintz. Dr. Hagan, if you can answer this next one, can you help us understand, we kind of touched on it a little bit earlier, but really how the vaccine works to protect people? How does that actually work?
So the two vaccines that we've started using, the Pfizer and the Mrna vaccine, are both what we call mRNA vaccines. So they have used, when the virus was first identified, of course, the first thing we do in our modern era is figure out the genomic sequence, the genes that the virus contains. And that was done very quickly, and it was also shared very widely. So as soon as that genetic information was available, companies started working with it to figure out what can we do with these genes, how can we figure this out. So what they did was create what's called an mRNA vaccine, which what it does is as you inject it into the person, it goes into the cell, not into the nucleus of the cell, importantly, but into the cell where we have a little factory that makes proteins. And it steps in line in that factory and helps the production of a protein. That protein is a protein that the virus itself also makes, but it's not the actual virus. So, people are not getting injected with these vaccines with an actual virus, just this little bit of messenger RNA. And then that protein being produced causes your own immune system to make an antibody because it recognizes that protein is not normal. So you produce those antibodies so that if you are ever actually introduced to the actual virus, you've got antibodies ready to go to fight that off. So that's how it creates the defense against the virus. It primes you and makes you ready to fight it off. Normally when you get infected with the virus, you will make antibodies, but it's going to take a long time. And while you're making those antibodies, you might get very, very sick, and you may even die of the viral infection before your body makes enough antibodies to fight it off. So this gives you a great jump start on that.
Wonderful. Thank you. Dr. P, shoot this one your way. Is there anything unique or different about the vaccines that have been done differently or approved for the COVID-19 vaccines? So basically, is there any protections that have been made for these vaccines different from other vaccines?
Yeah, so these vaccines are currently under what's called an emergency use authorization. So this is a expedited process by which we can it's not full FDA approval, but it is it's an emergency use authorization. So it's for in cases of emergency. It's basically allows us to use the vaccine when there's no other options for this particular thing. Both of these vaccines have undergone that, and this process still goes through the FDA. Both of those documents are actually available if you want to look them up. The FDA has released them, and so you can see the documents that were presented to the FDA that led to this emergency use authorization, and that's how we have gotten here so quickly and to our benefit.
Yeah, I know it seems like we're belaboring the point, but I just want to ask a question that people have and that they've been asking us, and probably many of you individually. With it giving that emergency use authorization, some people would say it's not safe because it went through the process so quickly, right? It's kind of like building a car. You build a car and you get a lemon, that kind of thing. What would you tell people similarly, but to the COVID vaccine, that it's safe, that they should take it, and that they're going to be okay in the long run?
Well, I point right back to the data. Is these studies that were developed are incredibly strong studies. The results are very reliable and fairly consistent. They have looked at these vaccines across very large patient populations. So that was 40,000 for the Pfizer vaccine and 30,000 for the Mrna vaccine. So these are huge patient populations in which this vaccine has been tested and speaks to its not only safety but efficacy as well.
Thank you, Dr. B. Dr. Duggins, what kind of protection should I expect from the vaccination? And how long will that protection last?
To my knowledge, at this point, I'll start with the latter part. We don't know how long the vaccination will last. So the hope is that it may last 6 months, or it might last a year, and hopefully it lasts forever, but we don't know for sure. That information is still ongoing. The flu vaccine, for example, many people will get it on an annual basis because the flu changes from year to year, the virus changes from year to year, and so we then have to adapt the vaccine accordingly based on educated guesses. With this, it's novel, it's new, so we are uncertain about that. Dr. Mins and Dr. Hagan might have more information about the length that it may last. At this point, my understanding is we don't know how long it will last, but at least it gives you a fighting chance by getting it now. And the hope is that at least for the next several months, hopefully 6 months or more, you'll be protected, given the data that we have so far from the studies that have been done starting last year. As mentioned earlier, we have over 74,000 people in those trials, and that data is still being reviewed. But the data that came through initially has demonstrated that the patients who, even after the first vaccine, started having some protection, and significantly improved with protection after the second vaccine. 2 weeks or less after the second vaccine, there was even more protection, and that's why the efficacy was so good. And also, again, touching the safety has been good. Yeah, there's some people who have reactions, but many of those people knew before they even took the vaccine that they sometimes have had significant reaction to medications or vaccines. And so many of them have been prepared to take the appropriate steps, knowing that despite the reaction, they will be protected against the virus being more deadly than most of the time the reaction that they have to the vaccine.
Dr. Mins, did you have a point you want to add to that?
Well, just to quote the studies or summarize the studies, 95% of the people who got the vaccine did not come down with the disease at all, compared to the group that got the placebo. A number of people still, like the rest of us who are unvaccinated, came down with the disease. There was a small percent that did get the disease, but it was very mild, and none of them had the severe catastrophic disease that people who are unvaccinated get. So that's how strong the data is. This is a very effective vaccine. Again, we don't know how long it will last, but we are lucky that the first vaccines out of the chute were so effective. In past years with other vaccines, it's a little bit of trial and error, and they develop a vaccine and it turns out it's not so good. Before it's released, it's not so good, and they have to go back to the drawing board. We were very lucky that the first two vaccines out of the chute were shown to be very effective. So thank goodness.
Thank you, Dr. Mins. And that actually brings to the next question. Someone asked, if I'm vaccinated, can I still get COVID like I can get the flu, even if I'm vaccinated? Does it make it less harmful or shorten the duration? And I think you answered a little bit of that. I don't know, Dr. Hagan, if you had any more, or Dr. Mins.
Well, I would say, just like Dr. Mins mentioned, the vaccine is not 100% preventative, but it's in the 90s. So avoiding getting infected, somewhere in the 90%, but it's not 100. So you could potentially still get the virus. What we don't know is how likely you would to still spread the virus to someone else if you happen to get it and you are vaccinated. But as Dr. Mins mentioned, a 90-95% efficacy for a vaccine is almost unheard of. We use a lot of vaccines every day in our medical practice that have much lower preventative effect for the disease they're designed to prevent. And we accept them and use them. So I agree. When I heard these 90+% numbers, it was shocking and very encouraging. But as he mentioned, what we don't know is, you could still get infected. Could you potentially still transmit it? It's possible. We do think that you would be prevented from getting a severe form of the disease that might land you in the hospital or in the ICU, or that might take your life. So in that regard, it's certainly worth it to be vaccinated. And we also don't know, because the studies have only been going on for several months, we don't know the duration of that protection. And I should mention the studies are really not over. We just had an interim analysis that allowed this EUA. They will continue to look at the people in the study to see, do they get COVID? Do they still have antibodies at certain points and so forth? So we'll have more information from the studies that have already begun and are still ongoing that resulted in the EUA for these vaccines. We'll have more data in 6 months, in a year, 2 years.
Wonderful. Thanks, Dr. Hagan.
I might add, as we vaccinate the general population, people with various severe illnesses will be getting vaccinated. Some people with immune deficiency diseases, or people who have had chemotherapy for cancer or something that affects their immune system. So I suspect that in some of those groups, the vaccine won't be quite as potent because it requires your immune system to process this vaccine and then attack the virus. If your immune system is very disabled because of disease or chemotherapy or something else, I suspect it won't be quite as potent, but I mean, it's still much better than not having. Obviously, if your immune system's that weak and you get the natural virus, you're going to be very bad off, presumably.
I would add to that if the rest of us got the vaccine, we're helping to protect those whose immune system is already suppressed, because we then create what many of us would like to call herd immunity. And the more of us that are protected against it, the more they are going to be protected. And that's our family members and our friends and coworkers. So definitely it's important for us to try and help others by getting the vaccine, not just for ourselves, but for others.
I think that's a really important point, because when I look at the people that I see that end up in the hospital and in the ICU with COVID, the first question I ask them, if they're awake and able to talk, is, how do you think you got this? Where did you get exposed? Who has it that you've been around, and so forth? And more in the last 3 months, the answer that I'm getting is somehow someone in their family gave it to them. Many times it's a college-age kid or even a younger child who had very mild symptoms. They didn't even know they had COVID, and yet the adult in the house got it, either the parent or the grandparent, and they're who end up in the hospital. So, when we talk about, that's why I'm so excited about vaccinating the general public, because sometimes these otherwise healthy people who get a mild case of COVID, it's, the answer I get is, what's the big deal? I just had the sniffles, sore throat, lost my taste and smell, and I feel fine. But the big deal is they can transmit it to someone else who gets very ill. And very rarely some young healthy person, and we have unfortunately seen people in their late teens and even 20s, teens and 20s die of COVID here in this community. Sometimes those young healthy people get a very severe case too. But most important with the vaccine is we allow those people to prevent other more vulnerable people from getting infected.
Wonderful. The next question, Dr. Minns, when I saw this question, I immediately thought of you. You today released an extended health order, so you'd like to talk about that for a moment. But the question is this: after I'm vaccinated, can I stop wearing a mask?
Well, the straightforward, simple answer is please don't do that. Please continue to do the precautions we've recommended all along since this thing started. We're pretty sure the vaccine prevents disease. Like we said, 90% or more people get the vaccine do not come down with the disease. We don't, and people with the disease are probably the best spreaders there are, because now the virus is replicating and multiplying, and it's in their secretions and whatever, and they are, and even some of them are super spreaders where they can give it to a lot of people. The studies didn't look at whether even the people who didn't get the disease, could the virus still colonize or get in their upper respiratory tree or their nasal passages, and could they potentially then transmit it to other people? The vaccine studies weren't looking for that. They were looking to see if it prevented disease. So that's still an unknown out there, and hopefully as we get more experience with the vaccines, we can learn that. Most of us hope and feel like it will decrease your ability to transmit the virus. But at this point, until we know better, we have more science, it's best to continue to do those simple things. I call it simple. Maybe people don't think it's simple, but wear a mask, that prevents you from spreading the virus to others. I think we emphasize the mask has helped you from spreading your secretions to others. It's not so much to protect you from getting it from other people. So until we know better how well the vaccine affects your ability to transmit asymptomatic colonization, I'll call it, we would like you to continue wearing the mask, keep the 6-foot distancing, avoid large groups, be respectful for other people's personal space.
I would just like to add a little bit to that is while getting the vaccine feels great, it certainly doesn't confer immediate immunity. And it takes a while for that to build it up in the system. And that's why it takes more than one vaccination. And it takes time between those. And even then, we're not seeing that 90+% efficacy until about 2 weeks after the second dose. So it's not instant, for one. And then the second piece is, like we were talking about with herd immunity. Until we get to that piece, the masks are still going to be just as important.
Dr. Hagan, if I've already had COVID-19, should I still get vaccinated?
That's a very good question. So some studies have shown that antibodies to the virus persist for at least 90 days after a natural infection with the virus. We don't know if they might persist longer than that. There have been some recent publications that suggest even if you don't have an adequate level of antibody in your blood, you may still have some memory cells in your immune system that if faced with the virus, they'll jump in and start attacking and preventing you from getting infected. So we don't really know how likely you are to be reinfected after a natural case of COVID. So that being said, that there's nothing that says you cannot get vaccinated if you've already had COVID. Some are suggesting wait 90 days after your natural infection before you get vaccinated. But I know plenty of people personally who had COVID, say in November or even early December, said, I'm not waiting. I want to get the vaccine. So they went ahead and did 1 and some even 2 shots. So, it's a personal choice. But I do think those people who have had COVID can't assume they're immune forever. So I think they will eventually need to get the vaccine.
To follow up on that question, Dr. Hagan, which vaccine is better? Is there one better than the other? Should I take one? Should I ask for one over the other? Which one is better?
Of the 2 we have right now, I really consider them about equal, both in their efficacy and in the side effects associated with them. So I don't see one better than the other. The other vaccines that are being studied that use different technology, we don't have all that data yet. So it may be in 6 months we'll be saying, well, there's this vaccine is preferred over the others. But at this point, I would consider them equal.
If a person gets both shots and exposed to the virus, are they still able to spread COVID to unprotected people? That's to anyone on the panel.
Well, that's kind of like what Dr. Menz just mentioned. We don't know that for sure. Could they become colonized and potentially spread it? So that's something that I think we will have data about that as time goes on. People will be looking into that. But right now we don't know. So we'd still say wear the mask, do the social distancing and so forth. So because that's not, you just wouldn't want to take that chance.
Yeah. The next question.
Can I ask a question?
Yeah, go ahead.
The safety of having the vaccination after you've had COVID, has anyone reported any issues with having the vaccine after they've actually experienced COVID and then taken the vaccine? To your knowledge, Dr. Hagan.
Yeah, I've asked that question of a few physicians that I know that had COVID and then took the vaccine, and side effects were no different than other people that we've talked to. Now, on a very large scale, I don't know. You would guess that someone who had COVID maybe 2 months ago has some natural antibodies, gets the vaccine, they're primed, and they may have a more severe reaction. But I don't know that that's going to play out, and I have not heard that just on a local level yet.
Do you all expect that we will get the COVID vaccine every fall, like we get the flu vaccine every fall? Is that something that people should look forward to moving forward?
I would say that's a possibility. again, we're just a few months into that. What I would anticipate is that the people who are in the vaccine trials, that someone's measuring their antibody periodically as they get farther and farther out from their vaccine. And if they see that their antibody levels are from the vaccine are very low, say at 10 months, then there may be a recommendation that you have a repeat dose. So that I think that more information will come about that. And we know from our influenza that we do get vaccinated every year for that. So it wouldn't be unheard of. We just don't know for sure yet.
Adrian, how would you check your antibody level?
It's not something I would say the general public is going to do. I'm talking about in the studies where they would actually measure that and know whether people have detectable antibodies. You can measure your antibody levels. I mean, we can actually, I think one of the local grocery stores is offering a $25 test to check if you have a COVID antibody. So, you can get them checked, but in terms of measuring a quantitative amount and so forth, that's what's being looked at in some of the studies.
So I might just add, the United States hasn't even known about this virus for a year. We're not even to the 1-year anniversary of this virus in this country. China just passed the 1-year anniversary. It's hard to learn the answer to all those possible questions when you've only had a short time to do it. It's taken us years to be comfortable with a lot of other diseases we have, but so we're still learning. So we haven't even had a 1-year anniversary yet or 1-year cycle to study this virus and answer some of these questions about how long does immunity last? Can you get the following season of viral and respiratory infections? Don't know. So I don't want to leave the impression that we have all the answers because again, we've focused so much on caring for the patients and getting a vaccine developed. Now that we have that done, we can move on to other research questions and start addressing them too.
I was told that there was a secondary gain for donating blood, that if you go to the Red Cross and donate blood, that you might be able to get your antibody tested as well. So that may be a free way of finding out whether or not you have antibodies to COVID.
Wonderful. Okay, this next question is related to children. What can you tell me about children in the vaccine? Is it safe for them to get? Has it been tested on children? Are all ages safe to get it? Will they also need to receive 2 doses like adults?
Well, so I understand that the trials for Moderna and Pfizer, the minimum age they would test was 16, for the other was 18. So it's not licensed for use in people below those ages. So we don't have any data on children, to my knowledge, at least on the 2 vaccines that are out now. I know that some of the companies that are developing some of the other vaccines are planning to do studies on children. And as you know, the children don't seem to get a severe disease by a big point. So I think the emphasis was on testing the older individuals because that's where we're seeing most of the very serious, dangerous, life-threatening disease. But I do think the companies will now be switching gears somewhat and starting to study it in the children. So I don't think we could ethically give it to children until we have some studies showing its effect in them. Dr. Hagan, you agree?
I agree, and I don't know if you were going to ask the question about pregnancy, because that's another question I get frequently is about, what about pregnant women? Well, the studies did not purposely include pregnant women. That was an exclusion. However, there were a number of people that in the studies, once they enrolled in the study and either received the vaccine or the placebo, found out they were pregnant. So there were some pregnant people that were vaccinated in the studies, and some of those babies have not even been born yet because the studies are so new. Some have and some haven't. But as far as the information I've seen is the outcomes have been fine with people that were pregnant that received the vaccine. So I think the way that it's being looked at right now is there's nothing that says you cannot receive the vaccine if you're pregnant or breastfeeding, but it's really more of a personal choice, and it's definitely something to discuss with your doctor that's caring for you during that pregnancy. So we make sure that everybody's on the same page. But I personally know a number of healthcare workers in the city that are pregnant that have chosen to receive the vaccine. Interestingly, in our COVID units, we have several pregnant nurses that have worked these months and months with this enlarging belly, trying to get into their PPE, and I know some of those people did choose, of course, to receive the vaccine because they have seen the terrible ravages of the disease, and they wanted to be protected. So.
I'd like to take some time to answer a question from someone from our Facebook Live video who's watching. So thank you to everyone that's watching tonight. The question is, if you've had both doses and are exposed to a positive case, so someone that tested positive, do you still need to quarantine and monitor symptoms?
I was waiting for Dr. Mins to take that one because I know that's going to be a question.
I was waiting for you to answer it.
Well, I would say, the rules I'm sure will evolve on that. And I look at the CDC webpage every day just to see if they've come out with a direction on one thing or another. And I'm sure they will eventually come out with a direction on that. But as we've said, you could still potentially be infected and not so much infected, but colonized with the virus, even if you have protective immunity, and you could potentially spread it. So, I think it's still better safe not to expose someone else if that's the case. But I'm waiting for direction from the powers that be about how that will be handled down the road. The CDC, as you know, has changed their rules over time about what do you do if you're exposed and how long do you have to quarantine and those sort of things. Those are kind of a moving target. But I think with more widespread vaccination, we'll see even more recommendations about that.
As I agree. Again, we're getting on the edge of our knowledge here. I wouldn't be surprised if the CDC would come out sometime in the next few weeks or months with some guidance on that. And you would think that if you've had the vaccine and your immune system is healthy, probably you wouldn't need to quarantine like if you'd never had the vaccine. But we'll see. That's speculation at this point.
All right, thank you. At this time, I'd like to transition a little bit. I've been receiving these cards, and I've got a number of them here from folks who are viewing us online. And a lot of these have to do with the logistics. And so this is where I'd like to bring in our health director, Adrian Byrne, into the conversation. Many people are asking, I'll just read just a couple very quickly. Why aren't you prioritizing those with medical issues, especially those with breathing problems? Kansas received over 24,000 doses. Why aren't they being delivered to people right here in our community? When will those who are elderly and or those with underlying health conditions be able to get vaccinated? And then one question I think we've all seen in the kind of news lately is that Kansas is last in administering the doses. Why are we so far behind other states? Adrian, if you'd like to kind of start us off with this part of the conversation.
Yes, hi, Adrian Byrne, Sedgwick County Health Director. We received our vaccine about a week and a half or two ago and started vaccinating EMS workers and health department staff that are currently taking samples to test COVID, and then vaccinators. And then one of our community clinics received a lot more vaccine than what they had anticipated and then transferred that to us about a week and a half ago. And so we quickly set up a large-scale clinic because we had thought originally that we might be looking at a large-scale clinic end of February or March because we didn't anticipate having this much vaccine. So since a week ago last Tuesday through tonight, I get to update your numbers, Akeem. We vaccinated approximately 5,200 people. And this is the first positive thing about COVID, because I think we can all agree that there's not really been anything positive. It's been really devastating for people in our community. But vaccine has been the first hope and positive piece of COVID. We are strictly following CDC and KDHE, our state health department's guidelines, and are not to move on beyond healthcare associated workers until we are given that green light. I did ask last week about moving to a particular population and was told, no, we need to wait to get that guidance from CDC. And we know with the approximate 10,000 vaccine that we have because of getting so much from a community clinic, there are far more healthcare associated workers than that vaccine, not counting hospital staff. And even though we know that not 100% are going to choose to get the vaccine, we are moving through the 50 to 70% maybe that may be willing to get that. So some of the questions I have received is, you've had this vaccine now for, a week and a half or so, and why aren't you moving on if you don't have all of your appointments taken? We started out conservatively with the numbers that we thought we could vaccinate, just because we were still getting volunteers in and hiring some contractual staff, because a lot of our clinic staff were still vaccinated. They're doing different other vaccinations and other services. So we started out conservatively, and also wanted to make sure that our clinic was flowing well. So we have increased our number per 15 minutes from 15 per minute to 50 per minute, and made that big jump last Friday. So I think the community is still catching up to the fact that they may have gone online last Friday and saw that there really weren't any appointments available. And now, we're urging them to check back, because there are many more appointments available. And so far tonight, and our last appointments tonight will be 6:45, we've already vaccinated over 1,200 people today. So the goal at this time, and all around the country, whether or not they're staying within those perimeters, because we know that not everybody is, it is for this first allotment to be for those healthcare associated workers. And the associated word was added to that because that's anyone that has contact, particularly, in the hospital or outpatient setting with COVID, people with COVID, and also ill people or the general population, anywhere from janitorial staff up to the medical doctor. So there are a lot of people that fall into that category, and wanting to give them some time to schedule, because this came, we received vaccine when we really didn't know that we were going to get it. So there were some communication glitches there. So our communication out to the medical providers was at the very last minute. And we know how those appointments can be scheduled far in advance for our medical providers and our clinics. So giving them more than a few days to be able to get in and get scheduled. If we have remaining vaccine, what KDHE has told the counties in Kansas is that there are plenty of counties in Kansas who did not receive adequate vaccine for their hospital staff and other community staff. So I've been in conversation with some of our surrounding counties that did not have adequate vaccine. So if we get to next week and our numbers are starting to dwindle down and we have openings in vaccine, then we're going to get those other healthcare workers vaccinated one way or another. With the information that Kansas is last in the country, what the governor has said, and also KDHE, is that there are data reporting glitches. And I've heard from some of the providers here in Sedgwick County and in other counties that they didn't know that they were supposed to report in the Vaccine Finder. And Vaccine Finder is the CDC federal system that we log our inventory into every day. And then there's a state system that accounts for the number of vaccines that we have given. So both of those systems need to have data input in daily, and not all of providers that are registered to give vaccine are familiar with the state system. So there's been some training lags, and then I think the system is overloaded a little bit. And so there's just some glitches. So there's a lot of vaccine that's been given out that has not actually been, it's not successfully reported to our state health department or CDC. So I know that KDHE is working on those glitches around the clock so that we can get that. And again, just to know that we've provided over 5,200 doses out just with the health department. That's not our community clinics that have received vaccine that I know that have been giving it to their providers. And that doesn't count the 2,000 or so that we have registered through Saturday. And we'll be getting appointments open for next week as well. So we know that vaccine, there is going to be enough vaccine for everybody eventually, but it's not quick enough. I mean, everybody on this call and everybody in Kansas and around the United States and world want to get everybody vaccinated as soon as possible because again, this is that hope and the light in the tunnel. But we have to follow the KDHE and CDC guidelines. We're all hoping to hear by the end of the week when, more about what phase 1B will be. CDC is calling those phases 1A, 1B, 1C, and 2. KDHE is calling them 1, 2, 3, 4, and 5. So we're going to find out hopefully by the end of the week more about refining the next phase and possibly when we can move into that, whether that's by the end of January or when that might be.
Adrian, let me offer you, can we possibly share kind of our COVID page and kind of show people who maybe don't know what this looks like really quickly,
Absolutely.
What they're looking at and where they can find information. So I'm going to share my screen here. And Adrian, if you can see it, I'll go over to the homepage and kind of let you take it away from there.
Yes, and so when we have, for the healthcare associated workers, they're able to go to the site and go on to the vaccine information page, and actually when they scroll down, they're able to click on that and schedule their appointment. And everyone verifies that they are a healthcare associated worker. And when they come into the clinic, they have to bring their license or badge or something on their letterhead saying that they are a healthcare associated worker. I think that scheduling system's pretty friendly. And then today we posted Akeem, I don't know if you can get there through this browser, but there is a exploring COVID-19 vaccine data story map that is best viewed with Edge, Chrome, or Firefox. And so you were able to pull that up, and the goal is to be able to have our numbers there daily where we can let you know how many we vaccinated. And I believe there's also a link for other providers to input how much vaccine that they have actually given as well. And this is it's a very rough by season because we don't know how much vaccine is going to be available at any one given time. I think KDHE finds out on Thursdays and then they decide how much each county gets. I don't know what their algorithm or how they actually figure that out. And then we find out a day or two before we receive that vaccine how much we're going to be allotted. So as we get more information, we will make this more specific, but at this time we're not able to tell people you could schedule in February, you could schedule in April. We just have been told by the end of the summer there should be plenty of vaccine for everybody that wants to be vaccinated.
Adrian, let me ask you this question. We've got lots of people who are asking, when can they get vaccinated? How come we can't circumvent the system? We've heard concerns about medical professionals. They're healthy, right? That's the misconception. How come those with those underlying conditions or those who are most vulnerable, how come we're not giving the vaccine to these folks? I know you say it's KDHE and CDC guidelines, but really what is the thought process behind that so people understand?
Well, the CDC, KDHE, all of us are wanting to get the medical providers vaccinated, so they are there and protected and healthy to take care of people that come into the outpatient clinics and the hospital, not just with COVID, but every other illness. They were going to the hospital for prior to COVID. So it's important to have the medical providers healthy. And if you can think about how anxious people are to be vaccinated, if there wasn't some system set up, what I call what we're trying to do is manage chaos. Because if we didn't have some kind of a system, if CDC and KDG and even us as a local health department through Dr. Menz weren't having some kind of a plan, I can't even imagine how just crazy that would be. And I hear, I mean, I'm getting such gut-wrenching emails as I imagine the doctors on this call are getting, just about the chronic illnesses and imploring me to be able to, get them vaccinated. And, what I can say is, as the goal is to get after this group is to start being able to vaccinate vulnerable populations, and we can't get to them soon enough.
Thank you, Adrian. Closing remarks, Dr. Menz, did you have any?
Well, I mentioned at the beginning that I thought it was a real amazing feat to get the vaccine developed and be so effective as fast as it did. I really do think that's one of the wonders of the modern world. I will tell you the next amazing feat, with such short notice, trying to get a system set up to start vaccinating a community over 500,000 people in a systematic way in which people can schedule appointments and not just get there and find huge crowds waiting in line. That has been maybe not as fantastic as getting the vaccine developed, but that's been a huge undertaking. And I want to commend the health department to the work they put in about finding a place they could do this, getting a staff up and trained, and taking care of all the paperwork and stuff that has to be submitted on these vaccines. It's been a huge undertaking. We're trying to do it in a systematic way so the groups that have been identified as the first in line get it, and then we move to the next group as quickly as we can. So it's been a real challenge.
Thank you, Dr. Menz. Dr. Duggins, I'd like to ask you this question specifically. We've got a couple minutes left, about 4 minutes. The African American Council of Elders, as well as the Black Alliance, had a very targeted campaign that we work with them on to reach the African American population. From the African American population, you hear many folks saying that they don't want to be test dummies, right? What would be your message to those folks tonight in your closing remarks, sir?
As mentioned earlier, many people have been tested before with this vaccine. So no one is going to be a test guinea pig, so to speak. No one's going to be a test dummy. This has been trialed on other people who volunteered to be participants in the trials, over 74,000 plus now. We've had Moderna, we've had Pfizer, we've had AstraZeneca, more known locally, that have been inviting people to voluntarily participate. And we've been encouraging anyone who is interested in being a participant to look online. They can go to the CDC website, or they can go to these companies' website and sign up for these trials. Sometimes the word trials itself can be a little bit intimidating for some people, but I explained to them that's how science has worked over the years. We make theories and then we try the things out that we think are going to resolve the problem based on the theories. That's how it's done. And then once it's proven in the phases, you go through phase 1, phase 2, phase 3, phase 4, then we can know, okay, wow, this is actually working and it's not causing any harm. So first of all, we're making sure no one's being harmed. And then second of all, that what we presume to be working is actually doing what we expect it to do. So the fact that, for example, the Moderna and the Pfizer vaccine is using this new technology that's been referred to, sometimes make some people a little bit intimidated. It shouldn't, because it's been around for many, many years, and it's been done in other areas of medicine. Now, with this new virus coming through, we just transfer that information to working to treat and vaccinate people against this new virus. So, and it's been working. And that's the thing. People have been demonstrating over and over again that this is actually working. The studies are not over. We still have another phase at least to go through for some of them, but based on the data that's been collected so far, the theories and the trials it has started that have been put in place to help treat these patients and prevent the disease progression and to prevent disease burden has actually been working. So I would strongly encourage everyone to understand no one's going to be a guinea pig. No one is going to be a test dummy. You are actually going to be helping yourself and others in preventing the disease in the community. I don't know if that suffices enough, but that's been the main message. This is not something, the virus is new, but the technology is not new. And the testing that's been done, myself, the other physicians on board here will let you know that we've stepped up to demonstrate to you that you are not going to be a guinea pig because others have done this. It's been done in the lab. It's been done in real life with other human beings, and it's worked well without causing any severe reactions that we think is worse than the disease itself.
I might just add the third vaccine that will probably be approved in a month or two is AstraZeneca's vaccine. The School of Medicine has been involved in that study. And as people apply to be in the study, not everybody's selected. They select people that represent the cross-cutting spectrum of our population. So they're trying to make sure that all groups are represented in those trials that represent our society. So they're trying really hard to make sure it really reflects our society and the people who are being allowed into the test.
Dr. Mintz. Dr. Pereira, closing remarks from you, ma'am.
So I would like to end on the enlightening note to this is as heartbreaking as it is that we don't have vaccine for everyone right now. I'm encouraged by the fact that so many people are excited to get it and see this as the path forward and kind of believe in the vision, if you will, and believe in a post-COVID world. So that is renewing and rejuvenating, and I'm excited by that possibility. So thank you, guys.
Thank you. Dr. Hagan, closing remarks from you, ma'am.
Well, I would ask for two things from the public that's listening to this today. I would ask for, number one, patience, because all of those people working in public health and in these vaccine clinics and so forth, this is really the first time they've ever done this mass vaccination with a brand new vaccine and so forth. So you have to have some patience that we are working our best to try to figure this out and try to make it as convenient for the population and as safe for the population as we can. And then secondly, I would ask for trust. Trust in public health. No one in the public health arena is trying to do harm to anyone. We are all trying to make the best decisions for the public, for their health. And I think that's probably one of the saddest casualties of the COVID epidemic is that I see an ebbing of the trust in public health. And I heard this on Facebook, or my friends, somebody put this on Twitter that, this is dangerous and I shouldn't take the vaccine. So people are more willing to believe strangers on social media than they are public health people who spend their life working and studying these things. So I really ask for the trust that people really put their trust in public health, that people in that role are doing their best to try to get the safest, most beneficial treatment for the population.
Thank you all. Thank you all. This is going to be viewed on Facebook after we close out of this. So for the folks who maybe didn't join us or you'd like to share this, this will be able to be viewed later, as well as on sedgwickcounty.org. In addition to the resource tool that we showed you with Adrian Byrne, please take a look at the Sedgwick County Facebook page, where you can find Deputy County Manager Tim Kaufman's presentation to commissioners today on the logistics of the vaccine and the story map that we showed you a brief snippet of, which includes reported doses given by the Sedgwick County Health Department and other providers here in Sedgwick County. Data are doses given by Sedgwick County Health Department and doses voluntarily reported by the health department by local vaccine providers. You may also call the health department if you have any other questions or concern at 316-660-1022. Again, thank you all very, very much for spending time with us this evening, and we hope you have a good night. Bye-bye.
Thank you.